Good afternoon. I'm Christina Graham, registered dietitian at Titus Regional Medical Center, and welcome to our Adult November Diabetes Support Group meeting. This is a special month because in November we recognize those people living with diabetes. In 1975, Congress established November as the National Diabetes Month. So I just want to recognize and honor those that are living with a form of diabetes this month. And I'll be sharing some information today about the basics of diabetes and some basic management skills. So what is diabetes? Diabetes is a variety of different medical conditions where a person is unable to keep their blood sugar quite what it should be. There are a number of foods that do turn into blood sugar known as glucose, and that glucose travels through the blood and it's supposed to be moved on into our muscles and into our cells, where that glucose then it can be used as energy. There is a critical hormone called insulin that helps move the glucose from the blood into those cells because your cells ultimately need that glucose for energy. But when somebody has diabetes, either they're not making enough of this hormone called insulin or any of this hormone called insulin, or maybe they're insulin resistant, where that muscle cell is just no longer listening to the insulin like it used to. In either case, ultimately what happens is blood sugar levels rise. Diabetes doesn't just start overnight. It's a condition that develops over several years. They estimate as many as 5 to 10 years before somebody develops type 2 diabetes that they will have prediabetes, which is a precursor to type 2 diabetes. In prediabetes, the blood glucose levels are running a little bit higher than normal, but it's not reached the point or the cutoff which we consider the diagnosis point for diabetes. Prediabetes is reversible through healthy lifestyle changes. Like I said, many people will have prediabetes for several years. This chart shows that a normal fasting blood sugar, that's if you've not eaten for 8 to 10 hours and you have a blood sugar test, a normal would be less than 100. And if your fasting blood sugar is running from 100 to 126, that's the prediabetes range. If your fasting blood sugar is running higher than 126, that's the diagnosis point for diabetes. In Titus County, in 2020, the health rankings showed that 11% of Titus County residents have diabetes, compared to the state average, which is about 10% of the population. So we are slightly at greater risk for a form of diabetes living in Titus County than the state average. And there are 3 main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 is an autoimmune-led type of diabetes. In this condition, the person's own immune system destroys the cells called islet cells in the pancreas that made insulin. So somebody with type 1 diabetes is no longer able to make their own insulin. They make very, very small amounts of it. This was not brought about by any lifestyle. So it wasn't brought about by eating too much sugar or unhealthy exercise levels or eating habits. It was essentially brought about by the person's own immune system going awry and destroying those insulin-producing cells. So it is an autoimmune condition, autoimmune-led condition. Type 2 diabetes is much more common than type 1 diabetes. And in type 2 diabetes, we feel lifestyle may be a larger factor in the development of this condition. In type 2 diabetes, the person's immune system is not affecting or destroying those cells that make insulin. However, maybe through gradual weight gain, decreased physical activity, other health concerns like high blood pressure, heart disease, this condition develops gradually over time, and it's led on by those stressing factors. The person is able to make their own insulin, but they're simply not able to make enough, or their muscles are no longer responding to the insulin like they used to, which is something we call medically insulin resistance. Gestational diabetes is another type of diabetes, but this one happens in the third trimester of pregnancy. It is often temporary, but it is absolutely a warning sign because as many as 50% of the women who've had gestational diabetes in a pregnancy within 5 to 10 years are developing type 2 diabetes. Gestational diabetes often does go away when the mother delivers her child. However, like I said, they are often at much higher risk for developing type 2 diabetes in the future. So those are the main forms of diabetes that we have. We also know that diabetes can be brought about by some medications. So there's other factors that can lead to the development of diabetes, but these are the big three that are recognized. So this chart shows that those people living with diabetes are just the tip of the iceberg. These numbers have changed slightly. We know that there are actually 34 million people now with type 2 diabetes in the United States. That is about 9% of the population. And there are still about 86 million people living with pre-diabetes. So if those people continue to have prediabetes, their blood sugar continues to rise, and they later develop diabetes, we are honestly going to have an epidemic of diabetes in our country. So this just shows that the statistic is that 1 in every 3 Americans or 1 in every 2 minorities born in 2000 will develop diabetes in their lifetime if the present trends continue. So we're definitely seeing a rise in both type 2 and type 1 diabetes. So who's at risk for diabetes? These risk factors include a person that has a parent, a brother, or a sister with diabetes, so they have a close relative who also has had diabetes. Especially with type 2 diabetes, we see a big genetic component, and so having a first-line family member who also has diabetes is definitely a risk factor. If you're African American, Hispanic, Latino, Native American, Asian American, or Pacific Islander, you're at more risk for diabetes. If you've had a baby that weighed more than 9 pounds at birth or were diagnosed with gestational diabetes, if you have high blood pressure, or if you have a low good cholesterol called the HDL cholesterol or high triglycerides, these are all risk factors for, in particular, for type 2 diabetes development. So in our country, every 24 hours, there are 4,384 new cases of diabetes diagnosed. Unfortunately, uncontrolled diabetes does lead to some very serious complications, and the next statistics are going to share some of those numbers. Every 24 hours, there's 195 non-traumatic lower limb amputations performed as a result of complications of diabetes. There are 128 people who begin dialysis for end-stage renal disease every 24 hours. There are 50 people that develop blindness every 24 hours. And finally, there are 839 people who die from diabetes or diabetes is a contributing cause of their death in this country. So those are startling statistics, and what I really would like to share today is optimistic information and positive and research-based information, not only about diabetes prevention, but also about diabetes control, because we can have a good and healthy life with diabetes if we are in control of this disease. However, if you don't have diabetes, these are known ways that you can protect yourself from this disease, that you can delay the development of, in particular, of type 2 diabetes. Just be clear about it. Type 1 is an autoimmune condition. We don't have any known ways of preventing type 1 diabetes. But type 2 diabetes, the more common form of diabetes, we have these steps that we can take to help delay or prevent type 2 diabetes. So the diabetes prevention trials found that losing 5 to 10% of our current weight, if somebody was overweight, was absolutely protective against diabetes. Also, studies have found walking at least 150 minutes a week, or basically 30 minutes 5 days a week, can protect. It does reduce the risk of diabetes as much as 67% in the studies and trials. Limiting foods that aren't very nutritious is also valuable. It's not that we have to be perfect, but consciously making healthier food choices, trying to minimize fried foods and greasy snacks, and going with healthier plant-based foods is very valuable. So increasing fresh fruits and vegetables is a prevention step. And then changing low-fiber starches like white bread, white rice, regular pastas to the whole grain version or a whole wheat version, that's also a good thing to do. Finally, studies have found getting a good night's sleep is actually something that takes stress off the body and does slightly lower the risk for type 2 diabetes. In the United States, there are 53 different types of sweetener used in approved sweeteners in our food supply. On average, Americans are consuming nearly 22 teaspoons of added sugar every day. Some big sources are sodas, sports drinks, coffee drinks, desserts like cookies, cakes, ice cream. Even things like pasta sauce and ketchup and dressings may be loaded full of added sugars. High sugar intake has been known to cause more risk of dental decay, but it also increases the risk of weight gain, of high blood fats, in particular high triglycerides, high blood pressure, and if somebody has prediabetes, this is a known risk factor for converting somebody to type 2 diabetes. So if you read a food label, there's a new line on the food labels that started this year called added sugars. And for every 4 grams of added sugar, we actually have approximately 1 teaspoon of sugar. So 1 teaspoon of sugar equals 4 grams of sugar on a food label. The American Heart Association recommends that if somebody is looking to prevent heart disease, prevent diabetes, and prevent some forms of cancer, a woman should limit to no more than 6 teaspoons of added sugar a day. That would be approximately 24 grams. And a man should limit to no more than 9 teaspoons of added sugar a day, or 36 grams. Those sound like big numbers to me, but these sugars, they add up quickly. The limit is not referring to natural sugars like the sugar in fruit, fructose, or the natural sugar in milk called lactose. What we're referring to is things like cane sugar, corn syrup, and other added sugars that have been added as sweeteners to foods. So here's a couple of tips about diabetes control. You really do want to work with your diabetes care provider, whether it be a medical doctor, a DO, your nurse practitioner, or a physician assistant, but you want to work closely with your diabetes care provider to see how you're doing with your diabetes, to make sure that tests are being done regularly on your blood sugars, your A1C, and so forth. It's also incredibly valuable with diabetes to know a little bit more about how you can change your diet, how to eat healthier, how to exercise a little bit better, given your other health concerns, to get a lifestyle going that's going to support your diabetes management. Studies have found a healthy lifestyle can reduce the amount of diabetes medicine that it takes to manage your diabetes. So that's really my specialty, is in helping people make little gradual healthy changes through diabetes education to get their diabetes into better control. It's also valuable if you're prescribed a diabetes medicine that you take it consistently and that you take it correctly. Different medicines are supposed to be taken in different ways. Some are timed with meals, some before meals. Some it doesn't matter whether it is with or before. You can take it at any time. You just want to take it at a consistent time. So understanding how your medicine works, what the best timing is, and how to take it consistently, that's valuable as well. At-home blood sugar monitoring is one of the best ways to control diabetes. There are so many different devices now on the market that can give a test result, a blood sugar result within 5 seconds. But knowing how you're doing, knowing how your number fares compared to the targets that are recommended for you, that's really valuable, because one of the dangers of diabetes is we can't feel our blood sugar very well. So if your blood sugar's high, you may not know your blood sugar's high. So regularly testing your blood sugar is a real eye-opener, because it really shows you how you're doing. I liken it to if you're trying to throw a dart at a dartboard with your eyes closed. You're probably not going to hit the bullseye very often. But if you know what your blood sugar is, you certainly know where you are, and you can kind of focus towards those goals. Eating regular meals just simply means it is valuable to eat every 4 to 5 hours with diabetes. Our body needs fuel or energy on a consistent basis, and when we're not getting our meals on a regular basis, things go on, like our liver may produce some sugar because it feels like our body needs the fuel and we've not eaten. Ultimately, that can lead to high blood sugars. So sometimes skipping meals and being real erratic with the timing of the meal can lead to higher blood sugar readings. So regular meals just means having a routine. Your body gets ready for that meal when it knows that time is about a meal time. It pre-prepares some insulin in response. It reduces the amount of spiking that your blood sugar has after the meals if you eat at a pretty consistent time. I usually tell my clients within about 30 to 60 minutes of the same time every day. It also helps if we eat a nice variety of foods. I'll show a plate in just a minute that shows that variety. It also is valuable to eat more whole grains. Foods that have at least 3 grams of dietary fiber or more, things like oats, brown rice instead of white rice, 100% whole grain bread or whole wheat bread, if you're going to eat bread, is valuable as well. We want to eat healthier fats. We know the unsaturated fats, like they have in olive, canola, and peanut oil, actually help to improve our blood fats. In particular, our LDL cholesterol. They help to lower our LDL cholesterol, which is the bad cholesterol, and raise a good type of cholesterol called HDL. So trying to replace some animal fats, which are saturated fats, with these healthier vegetable oil fats, that's really valuable, but doing so in moderation. So limiting the amount of fried foods, because even if it's fried in a healthier oil, it has more calories. So moderation just means trying to use those fats in small amounts. Teaspoon is a typical portion for oil, tablespoon for salad dressing, and so forth. It is also valuable to drink plenty of water. Diabetes, if you have diabetes, is a very dehydrating disease. It tends to make people urinate more. So staying adequately hydrated by drinking plenty of water throughout the day, and water over things that contain caffeine, is valuable. I've already mentioned limiting fried foods and going more with baked, grilled, and roasted foods, and limiting sweets. Foods with a high amount of added sugar, all of those things certainly can help better control diabetes. So here is a Choose My Plate. In this plate, you can see we've got 4 quadrants. The plate's kind of divided into 4. And you notice that vegetables are about 1/4 of the plate. Whole fruit, is particularly fresh fruit over maybe canned fruit that could have added sugars, are about 1/4 of the plate. Whole grains, like wild rice, brown rice. Grains even include things like pinto beans, peas, purple whole peas, for example. That should be about 1/4 of our plate. And then our lean protein, skinless baked or grilled chicken, fish, turkey, boiled shrimp, egg white, and then the leanest cuts of beef and pork. That should be about 1/4 of our plate as well. That's what makes that balanced meal. And when we have that nice variety, we have plenty of vitamins, minerals, and we're less likely to get too much of any one thing that might raise our blood sugar too much. So here I just have a nutrition label. This is for a bottle of Coke. And I just want to take that practice of remembering 4 grams of sugar equals a teaspoon of sugar. So if I look at this nutrition label, down close to the bottom under the words total carbohydrates, you can see it shows sugars. And on this label, it shows 65 grams of that added sugar. If I divide 65 by 4, I learned that there are 16.25, 16 and a quarter teaspoons of sugar in this bottle of Coke. This is a 20 ounce, just a regular 20 ounce bottle of Coke. And comparing that to that target that I was sharing that the American Heart, American Diabetes, and the American Cancer Societies convened and recommended to us of 6 teaspoons of added sugar a day maximum for women or 9 teaspoons for men, you can see right there that that's actually the amount of sugar for almost 3 days in that one Coke. Let's just take a look, and please don't feel this is just Sonic. This could be a Route 44 from any gas station. So if that Route 44 is filled with a diet soda, the added sugars would likely be about 0. But if that Route 44 is filled with a regular soda, Coke, Sprite, Fanta, a sweetened soda, it may have as many as 25 teaspoons of added sugar. The biggest source of added sugars in most Americans' diets is the drinks. Things like sweet tea, 10.5 teaspoons of sugar in this sweet tea bottle, or regular sodas, sports drinks, coffee drinks. They're absolutely providing a large amount of sugar. And if you have a gene for diabetes, and or you have pre-diabetes, these are stressors that if I regularly consume them can push me closer and closer to a diagnosis of diabetes. So really taking a look at the beverages you're drinking is a great first starting place. Really trying to incorporate more water in place of some of these sweet drinks could really help you delay or protect yourself from diabetes. So again, my name is Christina. I welcome calls. This is the number directly to my office, 903-577-6099. If you have questions, concerns, or if you wish to schedule diabetes education or nutrition therapy, please don't hesitate to reach out to me. I appreciate you joining me today for the National Diabetes Support Group meeting. I wish you a wonderful day.